Scholar. Thank you for tuning in, listening in on live here, E-Life Media. Thank you all for tuning in. It's a beautiful, beautiful day. Well, we had a little rain a little earlier, but that kind of ended, subsided, and we are here. We are here amongst the land of the living. It's beautiful to be back here live. I'm here in Capitol Heights, Maryland, E-Life Media Group. And we're going to have a good time having a good discussion here, talking about a much needed topic that needs to be discussed in the Black community. And so we're going to have a unique conversation that I believe needs to happen. We're going to talk about the urban kidney crisis in the African American community. And who I have joining me is Brother Stephen Belcher of the Urban Kidney Alliances. And so I just want to say welcome to you.
Thanks for having me.
Yes, sir. Yes, sir. Yeah, thank you. Thank you. And so we're going to open up this conversation and, and just really get into this, man. Many people, and I know your passion for this, and I've seen your work over the past few weeks, past few months. We had the opportunity to speak and just chat. And you've been pushing on this certainly in the Baltimore area. But first, just open up, and share just a little bit about your background, if I may. Just what inspired. Well, just share your background first and foremost, in terms of how you, kind of where you from, where you grew up, or whatever.
Sure.
Yes, sir.
All right. Again, my name is Steve Belcher. I'm Executive Director of Urban Kidney Alliance, which is a 501c3 nonprofit organization
Hmm.
dedicated to kidney disease awareness, prevention, education, and advocacy. I grew up in Washington, D.C.
Oh, all right, DC, DC.
Yeah,
All
yeah.
right. Yeah, that's right. That's right.
I
Yes,
grew
sir.
up in a section called Riggs Park.
Riggs Park,
Yeah.
DC. Okay. Okay.
Absolutely. And so basically, how I got to this point, right after, directly out of high school, at 17 years old, I went into the military.
Hmm.
Did 3 years in the military,
Okay.
and
Okay.
ended up in Austin, Texas,
Okay.
after I got out. And I had no medical training, but I saw an ad on TV for medical assistant, like one of those trade schools. So I
Mm-hmm.
went there and got into a medical assistant school. And maybe halfway through the course, I asked the job placement office if there was a place where I could work at to kind of get on the job training.
Mm.
So I ended up at this clinic called the Austin Diagnostic Clinic, and this was in 1985.
Mm.
So I knew nothing about dialysis. My wife at the time, and started doing dialysis. I was a technician for 10 years.
Okay.
Then a patient that I met that was that worked for the United Nations,
Mm-hmm.
and he worked for the United Nations,
Mm-hmm.
and he inspired me to go back to school. So I went back to school, got my associate's degree in nursing.
Okay.
Then I went and got my BSN
Okay.
from the University of Maryland in Baltimore, and I went back and got my master's. And so all along I'm doing dialysis and just doing what we normally do in dialysis, where a lot of us, we go to work, we work multiple clinics and do what we do and go home. Well, in 2014, I worked with one of the largest companies in the United States called DaVita Dialysis.
Mm-hmm.
And I
Mm-hmm.
was at one particular clinic downtown Baltimore.
Mm.
And I just started seeing patients going through different disparities. I seen patients who, at the time, I wasn't aware. I would educate. They would come in with blood pressures 200 over 130,
Ooh.
210, 220 over 140,
Whoa.
and
Whoa.
I'm kind of getting on them about not taking the medicine, but all along not knowing that they had to make a decision between getting the medicines or getting food.
Wow. Yeah.
And so
Yes.
So a lot of patients, they go through the social worker to get
Mm-hmm.
services, extra help, and they have organizations out there like the National Kidney Foundation,
Mm-hmm.
but they only give patients a stipend each year, and that's only $200 the whole year
Mm.
to have access to. So as I was saying this, kind of light bulb went off in my head. I saw the disparity. I saw that a lot of African Americans were on dialysis. It didn't hit me till just this one moment.
Right.
And from there, I started Urban Kidney Alliance. And it was created at first to help patients, and part it was to get funding to help patients like that. A lot of the corporations with their corporate giving, they don't, if it's not lined up with their values, they don't pretty much fund you. And they don't fund organizations that help patients monetarily.
Mm.
So I pretty much kind of came out of my pocket for a little while in funding this. And I mean, it set me back, but that's just what the spirit told me to do, and that's what I did. And so it got to a point where that was kind of becoming a financial burden on me. So what I decided to do is kind of change it over and do education. Excuse me, to do education and prevention. And that what led me to go back to school and get another master's in health education and promotion. So doing that course, that's what really got me involved, because now I had to do assignments that led me into West Baltimore, where I did my thesis.
Like where in West?
Pretty great area.
Okay. Yeah.
Sandtown, Winchester,
Yeah,
Harlem Heights.
Okay. Harlem Park.
Yeah, Harlem Park
Right.
Heights.
Yeah, right. Yeah.
And just seeing the disparity, and this was before the Freddie Gray, incident. So I was doing like a windshield survey where you ride through the community and kind of get a glimpse of what's going on, and that's when it hit me, where there was food deserts, a lot of corner stores, and just seeing the disparity. And this was before the Freddie Gray, incident. So I was doing like a windshield survey where you ride through the community and kind of get a glimpse of what's going on, and that's when it hit me, where there was food deserts, a lot of corner stores, and
Food, it's a lot of corner stores selling old food,
that
green meat,
but selling pretty much food high in sodium,
right?
Oodles and noodle chips, spaghetti in the cans. A lot of this packaged stuff has preservatives, especially the canned food, spam. When I noticed that, and that's when I noticed that it had to be some type of education, because again, I still work in dialysis, and I can't tell you how many people that I came in contact with when they first started dialysis said if they only knew, they only knew. Noticed that, and that's when I noticed that it had to be some type of education, because again, I still work in dialysis, and I can't tell you how many people that I came in contact with when they first started dialysis said if they only knew, they only, meaning kidney disease has 5 stages.
Okay.
And
5 stages of kidney disease. Take notes, y'all. Write these down.
okay.
5 stages.
And so normally the 5 stages go by certain numbers, and I have a card that this is part of. We have this hashtag.
Yeah, take that off. Let's show the people if they can. Good shot of that. First, let me look at it, and let me see. I don't know if everybody can see this, but various.
On the front of that is the advertisement. This is a press. This is a like a pass,
right?
A memorabilia pass for the tour.
The tour, Silent Killer tour.
Yeah, Silent Killer tour. has the dates and the cities that are projected to go through urban
Okay.
communities of talk. And then on the back is a GFR card, and
Yes, I wrote
GFR
that down. The
stands for glomerular filtration rate,
right,
and
right,
that
right.
measures your kidney numbers.
Okay, okay.
So, and on the back of this, it has, like I said, it has 5 stages. So, stage one, your number is greater than 90
Greater than 90.
or
Yeah.
less. Well, between say 90 and 120 is normal, but
Okay.
let's say 89 to 60 is stage two.
Mm-hmm.
So if you go and get this blood work done
Right.
and they tell you these numbers on this card, you can see what stage you fall in. Stage three, the number
Mm-hmm.
is 30 to 59,
Mm.
and that's moderate.
Okay.
Stage two is considered kidney damage with mild.
So stage two.
Yeah,
Going
that's
back up.
a
Okay.
mild kidney damage. Stage three is moderate, and then when you get to stage four, the number is 15 to 29. Well, 29 to 15.
Mm-hmm.
And then stage five is 15 and below. And once you get to stage five kidney disease, then you're pretty much in renal failure.
Mm.
And that's why they call it end stage, because you're at the end of the line pretty much. And that's when dialysis need to be initiated.
Mm-hmm.
The thing is, what gets a lot of people, when I say if they only knew, 9 out of 10 African Americans have stage three kidney disease.
You said 9 out of 10
9 out of
African
10
Americans
have stage three kidney disease and aren't even aware of it.
Okay. Okay.
So if you're not aware that you have stage three, then you're more likely to get to stage five sooner than later, because you're going to be continuing to do those same habits
Right.
that got you in stage three. And especially if you have diabetes or high blood pressure, then
Those are
those are the
two risk factors. I
and the
saw that.
leading causes of kidney failure
Diabetes
and
and hypertension.
hypertension.
All right. And so let's add on to those, because we getting different reports. And for those that may not know, full disclosure, I've worked as a EMT for the past several years in the city of
Okay.
Baltimore. So you get different. I mean, and I've worked with several medics, and of course, you always think about other signs and symptoms to know what to administer, or how to treat people with various levels of hypertension. But for the general audience, what is, when we talk about what is hypertension, what's a decent BP and I know that the American Medical Heart Association may have just came out with something new, but generally it's 120 over 80. I mean, that's
Yeah, but now they even say low.
yes.
In your veins. So, and that affects your kidneys.
Yeah.
So if your pressure is high, that's going to put a lot of strain on your kidneys as well.
Okay, so you want your pressure as low as possible.
Low as possible. And if anybody who's listening or watching, if they do have hypertension.
Did you bring your blood pressure cuff?
No, I didn't.
I saw it with your stethoscope. I was about to say we can do a live blood pressure check right here on me. But generally, my pressure has always been good. So I'm always looking at these signs, like you said, man. Because I mean, recently I've been experiencing some vertigo, and being a medic like I am, and having understanding holistic health the way that I do. I've had to kind of identify or dissect and try to figure things out. Like, all right, look, I mean, and I mean, knowing my age, and I started thinking about the different patients that I had. Started having me thinking like about what, totally like you said. Well, what am I doing? So I did get my blood working out, and I did write down the GFR. But I wish I brought my number to see. But we're gonna talk about that off air, because I can't recall what my GFR number were. But And this is what I learned. Sometimes, now, has it been your experience? Like, okay, what were their signs and symptoms and their BMIs and the diabetes numbers. So we're gonna talk about that too. But it started having me thinking like about what totally like you said. Well, what am I doing? So I did get my blood working out, and I did write down the GFR. But I wish I brought my number
Oh,
to
okay.
see. But we're gonna talk about that off air because
Right.
I can't recall my GFR number were. But and this is what I learned. Sometimes, now, has it been your experience, for instance, that some doctors may not even tell people that they are stage 3, or is that happening with blood
Yeah, I
work?
was going to talk about that. It's
Yeah.
funny that you mentioned that because when I was down in Jonesboro, Georgia, which is in Clayton County, just right outside of Atlanta, um, that's a town of approximately 5,000 people. But according to Medicare.gov, there's 74 dialysis clinics in a 25-mile radius
Mm.
of that town. And why I say that is because I talked to people even down there who told me that they had physicians who encouraged them to get what's called an access place at stage 3. Now,
Oh, like a port.
yeah,
Okay.
access in your
Yes.
arm that
Yes.
they use for dialysis,
Right.
because they're expecting the person to go to kidney failure. And I met
Yes.
patients here in Maryland as well who the doctor encouraged for them to get an access.
At
They're not,
stage 4?
no, at stage
At
three.
stage 3.
But at
Okay.
stage 3, that's only moderate
Right.
reduced. So you can halt the progression if you
Right.
change your lifestyle. You can halt the progression from advancing at stage 3. So
Mm.
you don't have to go to stage 5. That's the tipping point, in my opinion, right there at stage 3. If you know and you do something about it, it doesn't have to go to stage 5.
Mm-hmm.
It doesn't have to. But I think a lot of physicians don't tell. I think they may tell patients, especially African Americans, but a lot of patients that I come across don't take African Americans, but a lot of patients that I come across don't take it serious.
Right.
You tell
Yeah.
them,
Yeah.
and it goes really in one ear and out the other.
Mm-hmm.
And some they do manage it. So in some positions, they don't um, they don't hammer home the education. So I guess there's so many people that's being diagnosed.
Mm.
Um, they don't hammer home the education. So I guess there's so many people that's being diagnosed
Mm.
that it's almost like you got to keep it moving to a sense.
Mm-hmm.
You
So
know
it's like kind of like a what is it called, conveyor belt.
that it's almost like you got to keep it moving to a sense.
Mm-hmm.
You
So
know
it's like kind of like a what is it called, conveyor belt, if you will.
Almost, and then depending on what area that you're at,
Right. Right. Access
because
to medical
yeah,
care,
because
yeah,
and I want to say
if you will.
almost, and then depending on what area that you're at,
Right. Access
because
to medical
yeah,
care,
because
yeah.
and I want to say this with a lot of African Americans that I've seen, and when it comes to doctors,
Mm.
when they listen, most of the doctors are male Caucasian,
Mm-hmm.
and they may tell them one thing, but they don't ask any questions. They take it for face value and maybe not go get a second opinion
Mm-hmm.
or really do research to say, do I really need to start this or do this? I do a Facebook live show called Sunday Morning Transplant Coffee Talk.
Mm.
And I just had a young lady, her name is Mercedes McLean, and she was on dialysis, started at 12 years old.
Mm.
Her kidney disease.
Ooh.
Advocate for that to make sure, even to down to the getting the access on the arm, which had the um, um, the first rejection,
Mm.
she was on peritoneal dialysis. That's a
Mm-hmm.
tubing in your stomach. It's a
Mm.
different
Mm.
form
Mm-hmm.
of treatment.
Mm.
But they was trying to encourage her to get the access in her arm. And she said, no, she'll continue. She had the access port in her stomach. And so why you want me to have two different accesses and try to do two different treatments? So
Mm-hmm.
I say all that to say she was her own advocate, and she probably prevented a lot of unnecessary things just by advocating for her own health.
Mm-hmm.
And I think that's where we need to ask more questions, be mindful when we do go see the healthcare provider, especially when you go see a healthcare provider and they tell you that you may have pre-diabetes or you
Mm-hmm.
have hypertension.
Mm.
And again, a lot of people
Yeah.
don't
Yeah.
do nothing about it. I mean,
Right.
if you're going day to day and you're just trying to pretty much survive and
Mm-hmm.
I mean, you got a okay job, but you're just trying to deal day to day. You
Right.
don't think, and if you're not involved in any type of health or around that, you're not going to
Mm.
think about
Yes. Yes, sir.
diabetes, high blood pressure,
Right.
kidney disease. So you're going to maybe go to McDonald's or eat this or eat that, whatever you
Mm-hmm.
like,
Mm-hmm.
instead of, you know, thinking about fresh fruits and vegetables, drinking water.
Right.
So when they put all that stuff out there, it
Mm-hmm.
almost doesn't give you a option. It's not like there's a vegan restaurant on
Mm.
every corner, like
Mm-hmm.
it's a carry out or a bodega or one of those convenience stores on every corner in the urban community.
Mm-hmm.
I mean, you can go in there. They got the ATM. They got these bag of chips, wrapper type chips, and
Mm-hmm.
all this
Mm-hmm.
candy available to you.
Right. Right. Right.
But you don't see any healthy food. And
Mm-hmm.
just any healthy food. And just
Mm-hmm.
to piggyback on that, as far as Baltimore City, they had this program called Balti Market, where
Mm-hmm. Mm-hmm.
it was supposed to be urban markets in the community. It was supposed to come up. Piggyback on that, as far as Baltimore City, they had this program called Balti Market, where
Mm-hmm. Mm-hmm.
it was supposed to be urban markets in the community. It was supposed to come up with some initiative to have a lot of more fresh fruits and vegetables in their market. And even if that had to with some initiative to have a lot of more fresh fruits and vegetables in their market. And even if that had to come down to maybe getting a refrigerated unit to store this stuff in, but that hasn't happened. That program come down to maybe getting a refrigerated unit to store this stuff in, but that hasn't happened. That program I haven't seen a lot of advertisement for because it's supposed to also um, advertise and promote urban fan. I haven't seen a lot of advertisement for because it's supposed to also um, advertise and promote urban farming,
Mm-hmm.
healthy eating, markets that have fruits and vegetables in the community, and it's farming,
Mm-hmm.
healthy eating, markets that have fruits and vegetables in the community, and it's pretty much geared or promoted to senior citizens
Mm.
because a lot
Mm-hmm.
they have different station points where you can order. Pretty much geared or promoted to senior citizens
Mm.
because a lot
Mm-hmm.
they have different station points where you can order, and these station points are located in senior citizen buildings.
Right.
So if you live in the community, you won't even know about it. And these station points are located in senior citizen buildings.
Right.
So if you live in the community, you won't even know about it because it's in the senior citizen community.
Mm-hmm.
So I think it really needs to be more education out there too because it's in the senior citizen community.
Mm-hmm.
So I think it really needs to be more education out there to get people to see these diseases and the
Mm-hmm.
cause and effect of when it comes to healthy eating
Right.
and the two get people to see these diseases and the
Mm-hmm.
cause and effect of when it comes to healthy eating
Right.
and these urban diseases
Right.
like heart disease, diabetes, and
Mm-hmm.
high blood pressure.
Yeah. Sure. Yes. Yes. Agreed. Absolutely. Absolutely. So you again, one of the indicators, hypertension. What's up?
Urban diseases
Right.
like heart disease, diabetes, and
Mm-hmm.
high blood pressure.
Yes. 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 Agreed. Absolutely. Absolutely. So you again, one of the indicators, hypertension. What's up, Marvin? Marvin McDowell. I don't know if you know Brother Marvin. Topic here. Booming Moore is a good health advocate there as well. Marvin McDowell is Marvin. Marvin McDowell. I don't know if you know Brother Marvin.
No.
Umar boxing. Hey, Boomy. We're talking about a good topic here. Boomy Moore is a good health advocate there as well. Marvin McDowell is Umar boxing, working with the young people.
No, I know where Umar Boxing is,
Yeah.
right on North Avenue.
Right.
Well,
Yeah.
speaking of that,
Uh-huh.
I did a health fair at the Jewett Hill Community Court, which is right behind that Burger King. I can't think of that side street, but it's on McCullough. Um,
You mean Drew Heights Community Center?
yeah.
The Miss Quill, Nancy Quill.
But it's a building like
Yeah.
right behind. They're on the next street behind North
Oh,
Avenue.
okay.
But
Yeah.
I did a community health fair there. But I went out and just walked right up the street to North Avenue. So between McCullough, North and McCullough,
Mm-hmm.
and North and Druid Hill,
Yes.
block,
Yes.
there's maybe like 4 convenience stores,
Mm.
2 or 3 liquor stores, maybe 2.
Mm.
You got the Burger King.
Mm.
You got
Right.
you got the floor shop on the corner across from the Burger King.
Right.
Next to the floor shop, you got the funeral home, which is expanding.
Mm-hmm.
And then you have some next to that, the convenience stores. Then you got the church on Druid Hill and North Avenue.
Mm-hmm.
The point is, there's no healthy eating right there in that block. And so when I did a Facebook Live from there, I just connected the dots. You eat unhealthy there. You got the funeral right across the street where they can bury you, and they can have it right there at the church on the corner.
Right.
And when you go all up and down North Avenue, it's the same in each block. There's no healthy eating in that block.
Wow.
And in a lot of those stores at 9 o'clock,
Right.
and when you go all up and down North Avenue, it's the same in each block. There's no healthy eating in that block.
Wow.
And in a lot of those stores at 9 o'clock in the morning, you got the liquor stores open. So
Yes, sir.
this is the point. Where does somebody go on a Saturday morning that lives in that community that want to go o'clock in the morning? You got the liquor stores open. So
yes, sir.
This is the point. Where does somebody go on a Saturday morning that lives in that community that want to go out and get something to eat? They really don't have any choice other than corner stores. I mean, it's almost a setup. It's almost a setup.
Right. Yes, sir.
And the Burger King, and then the other corner stores. I mean, it's almost a setup. It's almost a setup.
Right. Yes, sir. Absolutely. No, that's a good point. These food deserts and wow.
And that's like that throughout Baltimore. You see the patients sitting
We gotta
there.
ask them. Have you got your full
treatment?
Right. Did they have the full treatment? And